Welcome to the deep dive. Today, we're digging into something really central to clinical mental health counseling, advocacy.
Yeah, it's a big one. And often maybe misunderstood.
I think so. We've got some interesting material here, stuff from a counseling course,
Hmm.
an article from Counseling Today, Advocate Today, that sort of thing.
Right. So the aim is really to figure out what advocacy is for counselors and maybe more importantly, why it matters, why you should care.
Exactly. And I thought this was a great starting point from our notes. The idea that sometimes who you know in advocacy can be just as vital as what you know.
That's interesting, isn't it? Kind of suggests it's not just about knowing the facts, but about relationships and networks too.
Totally. It implies advocacy isn't, something you do alone in a vacuum.
No, definitely not. And when you look at mental health counseling, we often focus naturally on the client work, the therapy itself.
Sure, the direct helping.
But advocacy is sort of the background engine, right? It helps create the whole environment for counselors and for clients, and it has real practical effects.
Absolutely.
Yeah.
That course document we have actually lists it, advocacy,
Yep.
as a core function. It's right up there with direct counseling, case
There's
management.
supervision,
Yeah.
leadership.
Yeah.
Yeah, it's not like an optional extra.
No, it's foundational.
And it's not just theory. The document actually connects advocacy directly to, well, jobs and money.
Oh, right. How so?
Well, think about it. If professional groups advocate successfully for, say, better mental health funding,
Well, yeah.
that can directly lead to more jobs being created for counselors, maybe even better salaries down the line. That's advocacy having a tangible impact on the profession itself.
That really grounds it. So it's not just this abstract good thing to do. It shapes the field.
Exactly. It shapes the whole landscape.
Okay, so let's break it down then. Our sources talk about different types of professional advocacy. It's not all one thing.
Right. It ranges quite a bit.
From working directly with a client right up to, trying to influence laws. Let's start with that direct counseling advocacy piece.
Yep.
What does that look like day to day?
So this is where the counselor steps in specifically for their client. The document gives some good, clear examples.
Like what?
Things like protecting vulnerable kids, the elderly, from abuse. That's a huge one.
Vital.
Or coaching clients on how to speak up for themselves. Self-advocacy skills.
Ah, okay. So empowering them to find their own voice.
Exactly. And it also mentions things like representing kids and families in schools, maybe dealing with school systems.
Which can be tricky.
Definitely. And helping clients who are underserved get access to the care they actually need.
So it's really about removing barriers for that individual.
Precisely. Identifying those roadblocks and helping clear them.
Okay. Then moving up a level, there's community leadership.
Yeah. Community leadership. Our materials describe this as more about building networks within the community.
So connecting with other groups, other people.
Right. Organizing things, maybe coordinating outreach programs. It's about mobilizing the community's resources for better mental health support overall.
Kind of expanding the focus beyond just your own clients.
Exactly. Taking that leadership role to make wider changes.
Then there's education as advocacy, which feels super relevant now with, the internet and everything.
Oh, definitely. The idea here is actively using platforms, websites, social media to get good information out there.
Information about what specifically?
About mental health symptoms, where to find treatment, reliable resources. It's about combating misinformation, too.
And the document mentioned NAMIONC.org and NAMI.org as examples.
Yeah, great examples of organizations doing just that, providing solid info to the public.
So it's about empowering people through knowledge, reducing stigma, maybe making it easier to ask for help.
Precisely. Knowledge is power, right?
Okay, now let's shift gears a bit.
Yeah.
Public policy, legislative advocacy. This sounds maybe more intimidating.
You can see them that way, yeah.
Yeah.
But it's basically about talking to the people who make the laws. Your representative.
Local, state, federal level.
All of the above. And again, the materials give practical tools, websites like senate.gov, house.gov.
And those specific North Carolina ones, too. Contacting the Congress.org and ncleg.net. So they're giving actual links you can use.
Yeah, making it concrete. Not just saying contact your reps, but showing you how.
And there was that quote from Counseling Today, something about legislators paying attention.
Yes, that was powerful. It said, legislators pay attention when they hear from their constituents, and if they don't hear from you, they may make uninformed decisions.
That can have an adverse effect on you and your community.
Wow.
Yeah.
It really drives home that your voice actually matters in that process. Silence allows potentially harmful decisions to be made.
That's a strong motivator. Okay, so besides direct policy stuff, There's also working within professional groups.
Right, professional association involvement. This is about working within groups like the ACA or state or local counseling associations.
How does that work as advocacy?
Often it's through smaller committees or working groups within those associations. They tackle specific issues, develop positions, and advocate collectively. There's strength in numbers.
A unified voice. Makes sense.
Then there's publishing, which connects back to education, I suppose.
Yeah, using writing, maybe videos, other media.
To influence how people think about mental health issues, client needs, educating the public, shaping the conversation.
Getting important stories and information out there.
Exactly. And the last category they mentioned is training.
Training. How's that advocacy?
It's about the future. Recruiting, mentoring, and training the next wave of advocates.
Ah, keeping the momentum going. Ensuring this work continues.
Yeah, building that sustainable capacity for advocacy, it's a long game.
So those are some pretty broad categories. Covers a lot of ground.
It really does. But one thing in the notes that really jumped out at me was this idea of micro-advocacy.
Yes, I thought that was fascinating too. Because it makes it sound less daunting.
Totally. It shows advocacy isn't always about big campaigns or, lobbying Congress. It can be much smaller, everyday action.
What kind of actions are we talking about?
Well, the examples are really practical, like going with a client to a thrift store if they need clothes, or to a food pantry,
Okay, just being there, supporting them.
or attending a doctor's appointment with them. Sometimes navigating healthcare is overwhelming,
Definitely.
or helping connect them with someone who understands benefits, like a benefits coordinator, or even just sitting down and helping them fill out those complicated forms for medication assistance.
Wow. Those things might seem small, but for someone struggling.
They can be huge. They can make the difference between getting help and falling through the cracks. It really grounds advocacy in direct, compassionate support.
It makes it feel achievable for everyone, doesn't it? Not just the experts.
Absolutely. It's something probably most counselors are doing already, maybe without even labeling it advocacy.
Right. Now, whether it's micro or macro advocacy, doing it effectively takes certain, well, qualities and skills, right?
Yeah, the document listed quite a few qualities like having good energy, being able to see things from someone else's perspective.
Perspective taking, that sounds key.
Crucial. And really listening to understand, not just waiting to push your own point or agenda.
That's a hard one sometimes, but so important.
Isn't it? Also, things like passion, obviously, persistence, because advocacy takes time, confidence, and being a lifelong learner, staying curious.
Okay, those are the qualities. What about skills? Things you can learn or practice.
Well, public speaking often comes up, even if it makes you nervous.
Uh-huh.
Debating skills, which links back to that perspective taking, being able to understand and respond to different viewpoints.
Makes sense.
Good writing skills are often needed. Research skills, definitely you need to know your facts.
And practical stuff, too.
Yeah, like time management, juggling advocacy with everything else. And partnership, building that networking piece again. Knowing how to work with others.
Because you rarely do it alone.
Very rarely. Collaboration is usually key.
And if you are doing something more formal, like a presentation, any tips there?
Yeah, the notes had some good points, like try to be hopeful, present a vision, not just problems.
Okay, positive framing.
Use good visuals, engaging slides, people respond to that. Bring in impactful numbers, data that tells a story.
Make it real.
And crucially, suggest simple, clear steps people can take. Make it easy for them to see how they can help or move forward. Don't leave them hanging.
Right, give them an action.
And just circling back quickly to the legislative stuff, the notes really hammered home that contact is better than just email.
Meaning phone calls, meetings.
Yeah, that personal touch seems to carry more weight. It's harder to ignore a phone call or a face-to-face conversation.
Good reminder. And that Advocate Today link was mentioned again as a resource for taking action.
Yep, counseling.org, Government Affairs Action Center. A
Yeah.
practical place to start if you want to get involved in policy stuff.
Okay, so wrapping this up, it feels like the big takeaway is that advocacy in mental health is, well, it's huge. It's varied.
Definitely multifaceted, from those really small, personal, micro actions.
Right up to trying to shape national policy. And it's not just nice to have. It actually affects the profession. It affects access to care.
Fundamentally, it impacts job availability, client well-being, the whole system.
Yep.
And even those small steps, when lots of people take them, can add up to real change.
Yeah, that collective power.
Mm-hmm. Which brings us to a final thought for you, listening out there.
Considering everything we've talked about, all these different ways to advocate, big and small.
What's maybe one single thing, even a tiny thing, that you could do, maybe today, maybe this week?
To support yourself or someone else in getting mental health care, or just understanding the issues better.
It doesn't have to be huge. Sometimes those individual steps are where it all starts. Something to think about.